Yes. And mute yourself. If I find anyone on the speaker now, I'm gonna throw you out of my class. Another minute, if I find anyone with their speakers on, I'm throwing you out of the class. It's not the first time you're attending any online class. There are only a handful of students sitting sincerely in my class, so I'll only teach them. No problem. All these people are sleepyheads or what? So okay, let's begin the class. I don't really remember taking any of your class off late. I was busy with third and final year students. So I really don't remember any of your names, and I'm so sure you don't remember my name because I don't think so. I've taken any class, maybe an introductory class or something for you. So let's just begin. Today's topic, as you can see, is this is for so apt for a second year student. Hard work will never disappoint you. And this is the time for you to start working hard. The best time because you're not even, asked to come to college. You can sit home, do whatever, at least do nothing, but at least study 1 hour a day, every day. Because I'm telling you, the moment we start the college again, the moment Corona is over for good, you're gonna have some real hard times. So make use of this time. People who really take time to study, make notes, this is your time, right? Okay, so moving on. So today's lecture will be about contacts and contours, right? Let me tell you something. This chapter, as a second year student, is going to be easy for you. But the moment you step in your final year or you're doing a postgrad in cons and endo, this chapter is exact reverse. It is a very, very difficult unit to understand when you move to higher classes. And why do I say so? Because this unit is very, very, it has a quite a lot of detail. Okay, but what I'm going to cover today is not a very elaborate version of this unit, but a very basic version of you. In fact, you would want to go back to your first year and relate to your dental anatomy classes as well. So I promise I'm not going to make it very elaborative and very difficult for you. Only as much as you can grasp and understand and write in your exams at this point in time. But what I'm trying to tell you with all that I just said is that at least by the end of this lecture, you should know what are the basics of contacts and contour. Okay, let's not even talk about the advancement, right? So before I move on to what exactly are we discussing today, I'm going to show you a very nice restoration, a class 2 restoration. The last time I taught this unit to your seniors was the time I actually saw their work in preclinicals, right? So I could comment well, I could relate what exactly they know, what they do not know. But with you people, I have not seen you in preclinicals because thanks to Corona, that is sarcasm speaking. But I really don't know how you work because you've hardly come to the college and you've not done anything in preclinics. So it's even more difficult for you to grasp everything like a theory on a theory aspect only. That is why I've got you this really nice diagram, really nice video, which is what you're going to be doing in your third and final year. Okay, so this is nothing, it's just a class 2 restoration. Class 2 restoration means it's a proximal caries which the person is making into a class 2 restoration and then also doing a filling or a restoration with amalgam. So sounds very easy, but it has a lot of elaborative procedures that you will be asked to do in your third and final year. So let's just quickly watch this video and then we move on. Before you miss on, what is this device that we're using here? That's a wedge. That's a wooden wedge that we're using. I'm going to be describing this in my subsequent slides. There's a thin wall of marginal ridge that we're leaving, and we're going to slowly remove it with the help of hatchet here. And why we've placed the wedge? For tooth separation and also to preserve the other tooth which is adjacent to the one we're preparing. That's a device which gets you amalgam in the form of capsule. Don't be overwhelmed with the information this video is providing. Everything will be very, very clear. Once you start moving with your lectures in second years, everything will be clear. So don't worry about whatever you're getting today. exactly what you'll be doing in the undergrad level for third and final year. This is just a call from my side to see if you guys are sleeping or listening to me. Anyone can quickly define dental caries for me? Quickly, very quickly, in a minute. Unmute yourself and define dental caries. Any one person. Anyone? Dental caries? Quickly. Nobody? This is actually my attempt to know your names and get to know this class. But nobody is actually aware of the definition of dental caries. That's strange. Anyone, even if it is not a perfect definition, it's okay. Any attempt from your side? I'm taking a screenshot of these people who've not switched on their Dora, Sneha, Shania, Chelsea, Shadul. A lot of you people are just there for attendance. The beginning of your undergrad, so we in our eyes actually affecting the entire 4 years. So that's okay. That's okay. Nobody for the definition of necessary.
Ma'am, you are not audible properly.
Okay, Priyanka. Define the entities for me. Quickly define them. Priyansh. Now suddenly I'm not audible when I'm asking you questions. I'm not audible. Nishant, please define them. Nishant, Nishant, don't act like you're not able to hear me. Yeah, yeah, yeah. I see that. The way you guys are carrying that body language, it's worse than a final year or an intern, you know? It's okay. This is my attempt to get to know you. You're not participating, so it's only.
Sorry, ma'am, you were not audible. I just came to know. Very low, ma'am.
Am I audible now?
Yes, ma'am.
No, ma'am, very little.
Very little, ma'am. Actually, not audible. I'm using speakers even. बहुत कम आवाज आ रही है.
Am I audible now?
Yes, ma'am.
Now. Am I audible? Yes or no?
Yes, ma'am.
Okay, quickly define dental caries. I don't have that much time. Now suddenly, everybody's gonna go. It's okay. It's okay. It was my attempt to get to know your class, and now it's only going to be a one-way class. So let's go on. As you know, the topic for today is contacts and contours and the very, very, very basics of contacts and contours. These are my handwritten notes so that you don't, complicate the class. And I've only got as much as is important for you as a second year student. So, okay, let's begin. Over a million years of evolution, the evolution has happened everywhere, right? Everywhere, be it humans, be it animals, everywhere. Same goes for the inside of our humans. Like let's talk about teeth now. So over a million years of evolution, the teeth have acquired a specific shape. Now, what you see inside of your mouth is a specific shape, or you can call it fundamental curvatures that individual tooth has. It's not like okay, one tooth and the other tooth, they look similar. It's not like that. Every individual tooth has its specific shape inside the oral cavity. We all agree to that? Yes, right? So individual tooth in the mouth has its specific shape, or we'd like to call it in our language as fundamental curvature. And what and why do we have these fundamental curvatures? It's because all these curvatures or all these specific shapes of different teeth that we have inside the oral cavity, they aid in preventing disease, damage, bacterial invasion, calculus buildup, dispersing excessive occlusal buildup or trauma or biting forces, or you'd like to call it masticatory load, also protecting gingiva and periodontium. Ever thought about it?
that why do my incisors look like this only, and why does my molar look like this huge and this big, and why doesn't my premolar is the same size as my molar, right? It all has sense, okay? So let's just, that is why I was asking you to define dental caries, but my bad, nobody actually defined dental caries. It was so easy, everybody's read it from Sturtevant. Microbiologic disease resulting in dissolution and destruction of calcified tissue. कुछ click किया? अगर नहीं किया तो then you guys are a very dumb class, okay? Sorry to say. So dental caries के लिए, if a patient approaches you after 3 years from now, when you have your own setup, and a patient approaches to you and they're like, I got caries, now you got to do something about it. And you're okay, fine. It's a restoration, it's a filling that I do for you. Okay, you start with it. What do you have to keep in mind while you're doing that restoration? First and foremost thing is you got to, whenever you take your device or a drill or a dental drill, a rotor, micromotor in your hand, before you put a ditch inside the tooth, just study the anatomy of the tooth. चाहे उसमें caries लग रही हो या नहीं लग रही हो, कुछ भी damage हो रहा हो, just make a mental image of this tooth before you actually manipulate it, before you actually restore it. Because if you end up with a faulty interrelationship between contacts, marginal ridges, embrasures, gingiva, then I'm sorry, you're going to lose the very essence of doing a restoration in the first place. I see somebody annotated on my screen, and that is just not accepted out of you. And somebody is still on speaker, which is very annoying. Ritu Kumawat, I'm going to throw you out of the class. Here I'm trying to build an actual, interactive session with you, and all you guys are doing is distract me. So I won't take that, right? Okay. So we were at, right? So we were at, if you want to see, there are some things called physiologic contacts and contours is the thing that God gave us, right? The physiologic contacts and contours are the things, the teeth are naturally the way they are. But when a patient approaches you and you have to restore it, you have to keep certain things in mind so that you can reproduce the actual contacts and contours. Now the question arises, what are these contacts and contours, right? Let's just quickly go about it. Now this is annoying, this green thing, it's already recording, so I would get to know who did this. Anyway. This is what I don't like about second years or whoever this notorious class is. They don't understand the gravity of the situation. Okay, so we're done with, okay. Over here, I'm gonna show you what is the basic difference between a contact and a contour, right? So if we just quickly, before we define, I'm gonna show you, if you look at this incisor, the two incisors, if you look at the two incisors closely, you're gonna see the two incisors are making a big straight line contact with each other, right? Do you appreciate this? Big straight line contact that these two incisors are making with each other. And then you move to laterals and you see, because the laterals are smaller in height, they still have a large contact, but not as large as the two incisors. Then you keep moving on the sideways, mesial to distal, you would see that the contact is there for individual teeth adjacent to each other, but the contact size varies, right? So I hope I'm trying to show you what contact area is. The contact area in simple layman terminology is when two teeth, they're touching each other, adjacent to each other, the touching contact that they make, or it can be a pinpoint contact, whatever a straight line contact they make is known as the contact area. Now let's go on to contours. Contours you can relate better, especially the girls sitting in my class. As you see, a lot of makeup artists, they're doing a lot of contouring on the face, especially their cheekbone, and a lot of, I am not very well abreast with it, but I do know that contouring they're doing in makeup as well. So you can relate better. There's a lot of makeup out there for contouring your cheeks and whatnot. So when you talk about contouring on the face, basically what they're doing the contouring on the convex portion of their face. The same thing applies here. When you look at a normal physiologic tooth, or when the next time you brush your teeth, just try to appreciate the convexity present on individual tooth of yours. You'd be able to relate better that incisors, or if you go back from there, medial to distal, you see that each tooth has its own convexity, right? That convexity is known as the contour of that particular specific tooth. And it varies from anterior to posterior. As you can see, I've got you an image of physiology contact, the one that is normal, right? So whenever you're supposed to restore a tooth, you have to study the tooth before you start even drilling the tooth, right? Before I move on to a video that I'd like to show you, please quickly write down the definitions, the textbook definitions of contacts and contours that you're supposed to write in your exam. Let's define contacts for you. The contacts are places on proximal surfaces. Okay, I'm so sorry. I had no clue that I got disconnected. Am I back? Am I audible? Anyone?
Yes, ma'am.
Yes, ma'am.
Where exactly was I for you guys? Contacts, right? Definition of contact.
Yes, ma'am.
Ma'am,
Contact
contour.
areas.
Okay. Two people are saying two different things. That's fine. Okay. Let's define contacts for you. Contacts are defined. Please write this down. Places on proximal surface of tooth crown where a tooth touches the tooth adjacent to it in the same arch when the teeth are in proper alignment. Self-explanatory definition. Let's move on to the contours. Contours, as I just told you, these are convexity on the facial and lingual surfaces that afford protection and stimulation of supporting tissues during mastication. How they support this protection, we are going to talk about in my subsequent slides. I repeat, what are contours? These are convexities on facial and lingual surfaces that afford protection and stimulation of supporting tissues during mastication. Let's go back to this image I showed you. Very clearly defines the convexity, and what this convexity is known as? It's known as the contour, right? It protects and stimulates the tooth when we talk about supporting tissues by under the load of mastication, right? Whereas when we talk about contacts क्या थे? These were the greatest bulges between the teeth, where just make it easy. The pinpoint or the straight line contact that the two teeth have together, that is known as the contact. After this slide, I am hoping that everybody knows the difference between contacts.
Ma'am, slide is not visible.
Slide is not visible. किसी और को भी slide नहीं दिख रही है, or is it just her?
No, ma'am.
No, ma'am means what?
No, ma'am, the slide is not visible.
The slide is not visible. Let me just. Oh, I haven't started the screen. Oh, I'm so sorry. You got to be a little quick, you know. I have defined the entire thing and now you're like, oh, slide's not visible. I know there can be an internet issue, but you got to be very prompt in your response. You don't have to be just very lazy. I covered the entire definition and then you're reminding me I got to share the screen. Is the slide visible now, Tishya? If I'm pronouncing your name right?
Yes, ma'am.
Your name's Tishya, right?
Yes, ma'am.
Okay, that's a nice name. Okay, so quickly write down the definition. I'm not going to repeat the third time. Contacts and contours. Quickly, and if you want, you can take a photograph of this. One good thing that I'm going to tell you right away is that I'm trying to put most of my lectures on my YouTube, so you can go, and that doesn't mean that you don't study with me. You have to study, but I'm just saying that since the lectures are being recorded, so I'll put it there, or you can directly mail me your queries, your questions anytime during your entire session of 4 years. You can just mail me your queries or whatever. So these are the two things you can, get to know. The classes are already available on the YouTube channel. The second is you can mail me your queries directly. Let's quickly move on. Slides visible now, right?
Yes, ma'am.
Yes,
Okay,
ma'am.
perfect. Let's go on. Since I defined contacts and contours for you, Here I'm trying to show you the contours, right? I hope by now you know the difference between a contact and a contour. Contours are the arrows that you show by which the food passing over facial surface and mandibular molars during mastication. Like in the image A, as you can see, I'm trying to show you image A, image A. I'm trying to show you over contoured. See, as you can see, the food will go inside. It's not a perfect contour. It will lead to food lodgement in the image, first image. In the second image, you can see it is a very droopy contour. It's a very under contoured area. Right? In the third one, it's a perfect contour. It's going just with the gingival flow only, and there won't be any food lodgement. This is exactly what you need to keep in mind while restoring your cavities. Right? Let's talk about contacts and contours. Right? This one I was showing you the contour. Right? When we talk about contacts, sadly enough, as a undergraduate, as a BDS student, you will not be able to do a lot of anterior restorations, and therefore you will not be able to appreciate the physiologic contact and contour of a tooth, and then establish or reciprocate that contact and contour in your restoration, because you hardly get to do an anterior restoration, right? But over here, I'm trying to show you like a big straight line contact between incisors, the one where I started. This one's between a canine and a lateral incisor. This one's premolar, pinpoint contact between first premolar and your canine. Then you've got two premolars here. As you can see, as you're going mesial to distal, your contact is decreasing in size. So you got to respect that, right? Contour, you already know that bulbs that you see on the facial surface or the lingual surface of any teeth, that are known as the contours. So enough about the contacts and contours. Let's move on. Where exactly, what are these, present? So as we talk about the anterior teeth, they're located closer to the incisor surface. What are we talking about here? What are we talking about? Anyone can quickly tell me?
Contact area.
Context.
Exactly, absolutely. Thank you so much. We're talking about the contact area. In the diagram that I have drawn, I've made a very, very small contact area, but you know it's a bigger contact than I've drawn. So in the anterior teeth, the contact area is located closer to the incisor surface. As you can see, incisor 1/3 में ही contact area start हो जाता है, right? Then we have posterior teeth located near the junction of incisal and middle third. Let's go back and compare. Junction of incisal and middle thirds. ठीक है? Lower portion of the tooth में present होता है contact, not on the upper portion, right? Easy. Let's move on. This is very, very important. I've got this from the book known as Textbook of Operative Dentistry, Marzuk. Very, very difficult to extract this book from anywhere, be it online, be it your library. Every college only has 1 or 2 copies of this book, and it's very difficult to procure this book. So please take this diagram down. It's very important. Take the photograph, go to the video, check it yourself on YouTube, whatever you want to do, but make sure you know. I have no clue why I'm losing my network again and again. Let me quickly connect to my hotspot because this is annoying for me. I'm sure it is annoying for you. Quickly, let me just quickly connect to my hotspot, and then we can just do a smooth class. I mean, it never does this, but today it's doing, and it's kind of annoying. Okay, don't tell me my hotspot's not working too. Okay, it is connected. Now quickly respond to me if you can see my screen. Can you see my?
Ma'am, not now. No.
Sorry?
Yes, ma'am. It's visible now.
Okay, thank you.
Even
Quickly
though
take this down. Yeah, it's not coming out the way I wanted this class to come out. So let me graph this class now. According to the general shape of teeth, all the teeth have 3 basic shapes only, right? इसके अलावा कोई shape नहीं होगी. Either it can be tapering, either it can be square, or it can be ovoid. All the teeth that you see inside your mouth, or any patients or any relatives or anyone, will have only 3 categories of shape. The shapes are tapering, the square shape, and the ovoid. The tapering shape, as the name suggests, क्या होता है उसके अंदर? The crowns are wider and there are narrower cervical lines. You know cervix, or you know the neck of the tooth? You've all read it in your DADS, right? So in cases of tapering teeth, There are wider crowns and the narrower cervices or cervix or the cervical line. Neck of the tooth is narrower as compared to the crown portion of the tooth. Clear? Please draw these diagrams exactly the way you're seeing here. In cases of the second category or the type of shape we have, it's square. It's box. A lot of most of the if you look at a guy's tooth, or if you look at look at your dad's teeth, you see that they have, and you compare it to your mom's teeth, you're gonna see that your mom's teeth are slightly tapered and your dad's teeth are slightly square, right? Because that's how the jaws are, made, and evolution between a man and a female, all of that. So box teeth are mostly box in shape, as you can see. They have larger contact area and they don't have a narrow cervices, right? In cases of ovoid, if you see, there is a transition. The transition means it will be a combination of the two. It can be tapering, it can be a square, right? Or it can be a combo of the two. You and me, we can have an ovoid transitional shape also. So whenever you go look into the mirror and brush your teeth, try to look at the shape of your teeth from today onwards, right? Okay, let's move on. I have defined quite in few of my slides earlier. Let's just quickly move past contacts and contours. Contacts were the greatest height of contour or location of greatest bulges, or the touching point of two adjacent teeth, if you'd like to call that, or if you define it easier. Then contours were the convexities. Now, the third thing that I'm introducing to you is known as embrasures. Now, each one of you sitting today in my class knows what embrasures are, because you all read it in DADH. Let's just quickly define embrasures. Start writing. These are the spillways or V-shaped spaces between the teeth. Provides passage for food during mastication and prevents food impaction. Now, what are these spillways or V-shaped spaces between the teeth? Let's quickly watch a video for it. I'm just going to start my video.
Interproximal spaces are called embrasures, which are the sixth component.
I'm sure now you can relate it to your DADH class, what these embrasures are. Pink colored area that this video is showing are known as the spillway, and that is why known as the V-shaped spaces between the teeth.
A natural smile. As we look at the six anterior,
Sadly enough, you will not get to reproduce a lot of embrasures in your undergrad level, because you would hardly get anterior restorations to do. But remember, after 3 years from now, when you set up with your own clinical practice, you exactly should know how to reproduce embrasures too. Sorry.
incisal edges. These incisal interproximal spaces are called embrasures, which are the sixth component of a natural smile. As we look at the six anterior teeth in a natural smile, we notice the dark shadows of the oral cavity accentuating the triangular spaces at the incisal edges. These spaces are the embrasures, which enhance the individuality found in natural teeth. There are subtle variations in the incisal embrasures, as you see here, between the centrals, laterals, and cuspids. In this case, you see the central embrasure at the midline. The centrals contact just above the incisal edge, leaving a small V-shaped separation. Between the central and the lateral, the distal of the central is rounded, as is the mesial incisal edge of the lateral. The teeth contact at the middle third, making the embrasure deeper and wider, and therefore more open. Where the cuspid meets the lateral, the rounded distal of the lateral and the mesial form of the cuspid make the interproximal embrasure deeper and wider as the teeth contact well into the middle third. As you can see on the six upper anterior teeth, the embrasures create the natural individuality of each tooth. Another aspect of embrasures is the ideal contact positions when viewed from the mesial and distal of the anterior
These
teeth.
are the contact points.
The mesial contact of the central is slightly elongated and more toward the incisal. The distal contact is considerably higher due to the soft rounded edge of the central. The mesial contact of the lateral, when viewed from the mesial, is a little lower than that of the central. However, the distal contact of the lateral is almost at the middle third. The mesial contact of the cuspid is in the middle third, further opening the embrasure. Notice that when the teeth are more rounded and youthful, as we show here, the embrasures and contacts are more open and closer to the gingiva, resulting in even more individuality and youthfulness. Conversely, in an elderly person where there has been significant abrasion of the incisal edges, we see almost no embrasures.
Right?
Equally important are the gingival interproximal embrasures, the V-shaped openings gingival to the proximal contacts that provide the...
Okay, I'm not describing the gingival embrasures today because you will hardly get to replicate embrasures in your undergrad, but you should know what these embrasures are. So I hope you've written the definition of embrasure. Let's move on to the marginal ridges. Now, this is a very important aspect as we talk about you undergrad people replicating marginal ridges in your class 2 restoration. The first video I showed you before starting the class today, you saw a class 2 amalgam restoration. Very beautifully, they tried to reproduce the marginal ridges. Now, what are these marginal ridges? These are rounded borders of enamel that forms mesial and distal margins. As you can see, the shaded portion on the right, the diagrams that I've drawn, the first one, the shaded area, mesial and distal marginal ridges. The marginal ridges of adjacent posterior teeth should be at the same height to have proper contact and embrasure form. Now, the second diagram that I'm showing you today, it's a little. I'm not going into a lot of technicality today, but all I'm trying to say is this marginal ridge is always present in two planes. One is a horizontal plane and other is a vertical plane, right? So whenever you're doing a class 2 restoration in your undergrad, that you'll be doing a lot, you have to know that you have to reproduce the marginal ridge at the same height, the one with the adjacent teeth. If you're reproducing the marginal ridge of this molar, the first mandibular molar that I'm showing you here, you have to make sure the height of the marginal ridge is equal to the height of the premolar, right? And that is why we say they should have the same height to form the proper contact and embrasures. Otherwise you will have food impaction, overhanging restorations, and a lot of problems. If you do not reproduce the marginal ridges after doing your restoration, what all can happen? These are the hazards of reproducing faulty marginal ridges. Just quickly write down. If the contact is too broad, if the contact is too narrow, if the contact is placed too buccally or lingually, if the contact is placed too occlusally, if there is no marginal ridge, right? Or if you've exaggerated the occlusal embrasure, if the marginal ridges are not compatible in height, that's what I told you for the premolar and molar. If the marginal ridges, if there is no adjacent triangular fossa. Now everybody should be aware what the triangular fossa is. As you can see, this mesial marginal ridge is connecting. This forms a triangular fossa. Let me not teach you the dental anatomy in this class, right? We're already falling short of time. Next is if you do not reproduce the marginal ridge which does not have a triangular fossa, if your marginal ridge is only in one plane, suppose it is only in horizontal plane and not in vertical plane, if your marginal ridge is too thin, what you do is you reduce the, if you're making a class 1 restoration, you remove the mesial side so much that your marginal ridge becomes too thin. If it is thinner than 1.5 mm, your restoration will eventually fracture, right? So kindly respect the width of the marginal ridge. I'm talking about a class 1 restoration, right? Let's move on. So my class today is not about taking you into a lot of depth of how to formulate or how to get a proper contact or how to get a proper contour, but my class is basically an introduction class to what all you will be doing for an amalgam restoration. So how do you fabricate, how do you formulate such contacts is based on two methods. One is the tooth movement, the second is matricing. Don't have to worry about either of them because tooth movement will be taught to you in cons also. It will also be taught to you in ortho when you go into a higher class like a final year. And matricing, it's going to be taken care of in your subsequent classes only, like maybe a month or two. We will teach you matricing as an entire new subject in cons, right? Just introducing you so you know contacts and contour पे question आएगा तो what all I can write. Tooth movement, just write down the definition again coming from Marzouk. It is the act of separating involved teeth from each other, bringing them closer to each other and or changing their spatial position in one or more dimensions. Now don't get confused between the definition. It's trying to say it can either separate the involved teeth, right? It can either bring them closer or it can also change their spatial position in one or more dimensions. It all depends on the situation that you're dealing with. It all depends on case what you're doing. Case to case dependence of tooth movement. Whatever in three of these options, whatever you want to do, you got to move the teeth. Now just go back to the video that I showed you. There was a placement of a wooden wedge, right? Why did we place that wedge? For the tooth movement. We got to move that tooth thoda sa, like in millimeters or so that that matrix band that you used to adapt to the tooth to get to the fabricate a wall of your amalgam restoration. Why you did that? You got to, before you do that, you have to separate the tooth. Otherwise, your matrix band will, or that device will not go in between the teeth, and it will not help you formulate the missing wall, right? Next, here I'm trying to, yeah, this is exactly what matricing is all about. The second method is matricing. As you can see, we've placed a device which is going to create a wall, the missing wall on both the sides. It's a MOD cavity, which is mesial, occlusal, and distal cavity. You've made the cavity, you've removed the caries, made a class 2 cavity on both the sides, and now you have to do a amalgam restoration. And therefore, you've replicated a device to create the missing walls, and this is exactly how you're going to fill the restorative material inside, condense it. As you can see, we've placed two wedges just to create a little bit of tooth separation for your matrix band to go inside. So matricing is a procedure whereby a temporary wall, I repeat, temporary wall is created opposite to the axial walls surrounding areas of the tooth structure that were lost during preparation. All I request you to do is just write down whatever is important. In the subsequent classes, when they teach you fundamentals of cavity preparation or maybe class 2 cavity preparations, you'll be able to relate much better to my class. So please make sure you have your notes in handy when you can relate to the chapters which are taught now after this. Matricing is a procedure whereby a temporary wall is created opposite to axial walls surrounding areas of tooth structure that were lost during preparation. Have to write the definition exactly like this. So I told you two methods earlier, which were tooth movement and matricing. Now I'm going to describe thoda bahut about tooth movement. The tooth movement will be dealt in ortho also, but here I'm introducing the principal method of tooth movement. It is further divided into two methods. One is rapid or immediate movement, and the other is slow or delayed tooth movement. Right now, since we're talking about rapid or immediate movement, you just have to look for wedges, because in conservative dentistry, all we ask you to do is use wedges. So everybody from today should know wedges come under the rapid or immediate tooth movement. Obviously, the patient is sitting on your chair and now you desire a tooth movement so that you can place that device and go about with your restoration. So it has to be a rapid or immediate movement. And if anybody of you is undergoing an ortho treatment, they know that orthodontic appliances are a slow or delayed tooth movement. What are we desiring for an ortho treatment? Anybody who's undergone or still going has braces should know that whatever appliances are used on their tooth, a bracket or wire, is basically an orthodontic appliance, and we're looking for moving your tooth slowly, right? So these are two methods: rapid or immediate, slow or delayed. Under rapid, again we have two methods. One is the wedge method and the other is a traction method. Just knowing the names at this level is sufficient for you. Wedge method is further divided into Elliott separator or wood or plastic wedges, the one you saw in the video. Next we have is traction method. Non-interfering true separator is one of the devices. The other device's name is Ferrier double bow separator. I repeat, just knowing the names is very, very much sufficient for you as a second year student. But at least make sure remember the names. If you do not, then I'm sorry, you're not going to get any marks in the exam. Rapid or immediate, wedge method and traction method, right? And a slow or delayed tooth movement, you have three methods again: separating wires, oversized temporaries, orthodontic appliances. I repeat, separating wires, oversized temporaries, and orthodontic appliances, right? These are the two methods. Now, what is I have to emphasize on wedging, because that's what we do in conservative dentistry. That's what you're going to be doing in no time, after 1 year or so. Wedging is basically wedge comparable to dimensions of future gingival embrasure is chosen and tried. As you've seen in the video also and the images that I showed you, wedge is the area that wedge is placed in the area where your gingival embrasure is, where your embrasure is. So you basically choose a wedge which is the size of that particular gingival embrasure, and that is tried, because that is exactly what is going to cause the tooth separation. It is always placed from the opposite side of retainer attachment. You have to write this. This is a Viva question. Where exactly, what side do you place the wedge? Right? Lingual to buccal. It is always placed from the opposite side of retainer attachment. Retainer is a device in which you place the matrix band, right? Which will create the temporary wall. So wedging techniques, quickly write down the names. I promise we will cover these wedging techniques in details when we teach you the unit of matricing. So don't be all overwhelmed with the data that I'm sharing with you today. These are just the names for you to know how to fabricate perfect contacts and contours. Wedging techniques are known as single wedging, double wedging, wedge wedging, and piggyback wedging. We will describe these in detail because these are the most important things in cons. So do not worry. Just remember wedge place kahan se kahan karte hain. We place it in the direction which is opposite to the retainer attachment. This is the best answer to give when a person or an examiner asks you कि wedge जो है वो place कैसे करते हैं, buccal to lingual या lingual to buccal. So you should answer by saying it is always placed from the opposite side of retainer attachment. Let's move on to, for your information, wedging was a rapid or immediate tooth movement method. Next is when to place more than one wedge. As you saw in the video also, there was only one wedge placed. Now sometimes there are conditions where you have to place two wedges also. Now exactly how do you know I have to place two wedges? The conditions where gingival margins are very apically located. They're very towards the root side. So that means your embrasure is quite large to hold one wedge. And that is why you have to use two wedges. The second one is proximal preparations adjacent to a very exaggerated interdental call. You have read this interdental call, right? You have to just look at the spillway or the embrasure area of the tooth to be restored. If it is quite large, then obviously you can make use of two wedges. The techniques that I've showed you here, piggyback, wedge, wedging, these are the techniques. When we describe, you will eventually know exactly kitne wedge lagne hain. I'm just trying to open your heads here and trying to tell you what is the conservative aspect of this unit. Matricing was the other method, right? As you saw in the video, that a device was used, a Toffelmeier retainer, and a matrix band was used. So that comes under the technique of matricing. It has two components. The one is a band, right? The band which was a silver colored band that you saw, which was supposed to create a temporary wall on which the restoration was condensed. And the other is the device itself, which is the retainer. The band is a piece of metal or polymeric material which is used to support or give form to the restorative material. Easy, very, very well self explanatory. Retainer is a device by which band can be retained in its designated position and shape. It could be mechanical, it can be wire, it can be a dental floss, or it can be an impression compound itself, right? So this is all about band and retainer. These are the types of retainers or the devices that are used to hold the band which you see on the right side. The, as a juvenile dental student, as a beginner, there's immense, massive information that can be thrown at your way. But I'm introducing you very slowly so you don't feel very overwhelmed. So I'm just showing you the very very basics of matrix band and retainer here. The one on the left are the devices or the devices that will hold your band to create a temporary wall around the tooth, right? quickly write down. This is again coming from that great book Marzouk of Operative Dentistry. You will not find this slide anywhere on Google also. This is only from that book. In exams, if you have a question on be it contacts, contours, or be it the matrices, retainers, and wedges, if you write these 14 matrices, I'm sure the examiner will be very impressed and they will give you more marks than you deserve, right? So just quickly write down the names: double banded TOEFL Maya, single banded TOEFL Maya, ivory matrix number 1, ivory matrix number 8, blacks matrices, the black guys again your GV black, soldered band or seamless copper band, soldered band or seamless copper band, anatomical matrix, roll-in band matrix, S-shaped matrix, T-shaped matrix, band strip matrix, crown form matrix, window matrix, aluminium or copper collars, aluminium or copper collars. So if you have at least written the names and you'd like to see their images on Google, please Google it. I didn't get the images because I thought you'll be shit confused. What exactly is she teaching us? We don't really know. So you just stick to this image and just create an image of that video I showed you, right? How to fabricate a class 2 restoration, right? So before I end the class, first of all, I'm going to do a revision of this because of my bad network, so there was a little on and off. But before I do a recap, I would want if you've got any questions, you got to shoot me up right now. Any questions, please? Now is the time. Hit me with your questions quickly before I do a recap. Okay, if you're not asking, then I'm gonna ask. It only goes 2 ways. Tisha. Please unmute yourself, Tisha. Is it Tisha or Tisha? You're not audible.
Yeah, now say please.
Yes, ma'am.
Is it Tisha or Tisha? T or T?
T.
Tisha. Okay, Tisha, can you quickly, in your own words, tell me what is the meaning of contact?
Ma'am, contact areas. Ma'am, it's the point at which two teeth
Yeah,
meet.
yeah, quite right.
Either this.
The contact point is the area where two adjacent teeth are touching each other. As simple as
Yes.
that, right? I hope you have, you know what is the meaning of this, right? Vanisha, can you quickly tell me what is the meaning of contour?
Ma'am, it is the maximum convexity on the facial and the lingual surface.
Absolutely. I'm sure she's into makeup. Okay. Thanks, Vanisha. Next is I'm going to ask Nitesh Kumawat. Nitesh.
Yes, ma'am.
What is the meaning of embrasure? Anything that strikes your mind quickly. जो भी मन में आ रहा है.
मैम जो अपने स्किल्स होते हैं उनके ओक्लूजल जब वो टच होते हैं तो उनके जो गैप रहता है उनमें.
Okay, maybe you have understood, but the way you're defining is not coming out well. Suman, can you define embrasure in your own term? Suman. Yes, Suman, we can see you. Quickly define embrasure. Suman is like, haha, BBC reporting.
Ma'am, V-shape.
V-shape, yes, you're coming out right.
मैम टू टूथ के बीच में जो वी शेप होते हैं
वो कौन सी साइड पे होते हैं? वो जिंजाइवल साइड पे होता है, वी शेप.
यस मैम.
Yeah, Nitesh, now just quickly understand the meaning of spillway. or your embrasure, you see a premolar. You see the space between the premolar, the space that you can see, right? एक तो हो गया contact area, जो तुम्हारी बैच में अभी explain किया, right? जो touch कर रहा है वो point is the contact area, right? But the spillway or the V-shaped area that you see, right? Can you note that? Nitesh, yes or no?
Yes, ma'am. Yes, ma'am.
I showed you this beautiful video where they described. Yeah, exactly. I'm sorry. Nitesh, this is exactly what your embrasures are. This is exactly what I'm trying to show you. It has two components. It also has a gingival embrasure component, right? So these are 6 things that I described to you. One was contact, the other was contours. Then we had embrasures. What was the fourth thing? Anyone? What was the fourth thing? What was the fourth? Nupur, what is the meaning of marginal ridge? Nupur Sharma? What are marginal ridges?
medial से distal का जो distance होता है, occlusal separation.
That's a very, very not right definition. Medial से distal का जो distance होता है. Huh? Khushi Agarwal, quickly define marginal ridges for me. Nupur, I think you.
Rounded borders from mesial and distal margin on the opposite surface of posterior teeth and lingual surface of anterior teeth.
Yeah, anterior teeth में कहाँ से marginal ridge आ गई? I think everybody's gotten it wrong. So here I'm trying to describe you again. Look at this. This is the first mandibular molar. 1, 2, 3, 4, 5. 5 cusps are there. The shaded area is the triangular surface here from triangular fossa till the edge of the distal portion. From triangular fossa till the edge of the mesial surface. This is the area which is known as the ridge. Ridge मतलब ridge को अगर हम define करें is the edgy portion, the side portion of a tooth, right? It is not the distance, Nupur. It is just that edgy portion on the tooth, right? Rounded border. It is not the distance of enamel that forms the mesial and the distal marginal ridges. Now, quickly, last question that comes your way. I don't think so we can do a recap, but I'm going to throw this question at you so that you know exactly. Only handful of students with their cameras on, so this is quite disheartening. Madan Chaudhary. He's got a very rowdy image. Madan Chaudhary, are you there? Madan. That's quite disheartening to see you guys not paying attention. Ayushi Spade. Stop showing your sibling in the video. Quickly tell me what are the movements, what are the methods to fabricate perfect contacts and contours?
Ma'am, tooth movement
Yes.
and
Nitesh, can you answer? Complete your answer.
metrizing.
Matricing, yes, absolutely. Nishant, quickly tell me what comes under, what is a rapid movement, a tooth movement? One of the methods of rapid tooth movement.
Tooth movement.
Rapid movement. Anyone can quickly answer?
Ma'am, wedge method.
Yes, that you will be using a lot in your conservative dentistry. Okay. Since I really did not get a very interactive session from you, so I'm thoda bahut disappointed with your class. I hope you're able to break the ice, and the next time I have a class with you, you're more interactive with me. And sorry about the network glitches from my side twice today. But to overcome that glitch, I'm getting you this lecture on YouTube. You can go see, make your notes, complete your notes in case you missed anything. But that is not the answer to all the, whatever discussions we had today. You can easily approach me, write me right away if you have any doubts which are unanswered or which strike you after the class is over. Just write to me on my email, and I will be as prompt in answering as possible. Okay. So with that note, I'm gonna end the class. You guys be safe. Take care of your parents.
Excuse me,
Have a
ma'am.
good day. Yeah, Tisha.
Ma'am, actually, I needed to ask about the practical work thing.
Okay, please go ahead. What is your question?
Ma'am, like we don't have the records right now. So can we do it after lockdown is over? Because there's a lot of things to be written down.
When was the last date of submission? Did they give you any date?
No,
Who
ma'am,
are-
no dates.
Nobody has the record.
No, ma'am.
Nobody.
No, ma'am.
That's a sad thing because these were the perfect holidays to complete your record work. Okay, let me just get back to you because this is important, right? Because you have massive holidays coming your way and you can easily complete, no headache of other lectures or other preclinical work and anything. Let me talk to sir and I'll get back to you on this, okay? The next class, whoever is taking
Thank you, ma'am.
record department, they will keep you posted on this, okay? Okay. With that note, I'm going to end my class. I would want to take more questions if you have, but since they allow me only 1 hour, so write me back or whatever. You can write me after 6 months. I'll be very prompt in answering, or whenever you're preparing for your exam, and that's when you strike a question, just write me then also. Okay. Hopefully, the next class will be a little more interactive. You got to keep asking me questions. Anybody who's annotating will be thrown out of the class. Anybody with their cameras off, I have taken a screenshot. I'll remember your face till the time you're passing out from the college. Okay. You guys have a good day. Take care of your parents and bye bye.
Thank you.